Welcome to Conversations with the Winners. Today we're having conversations with Carol Zernial and Daryl Quarles, two of the winners of the 2020 Robert Wood Johnson Foundation Award for Health Equity. Carol and Daryl, welcome. Let's start from the beginning about the making of the WellMed Charitable Foundation Senior Activity Center. How did it come about? Daryl?
And I think it all started with me applying for a grant for a small amount of money to support our senior program division. After I applied for the grant, I received a call from Carol Zernial, which I had never met before, I knew very little about. And we had a conversation over the phone with the possibilities of us increasing the grant to support our program. And it just went from that to bringing park board down, council members, my director of Dallas Park and Rec, and things just took off until we was able to put this great program together, this great partnership that I'm so proud of.
That first conversation was such a catalyst because we really felt like we had a common mission and a common goal. We were new in the Dallas area and we were also looking for a home. And we really felt like we had tremendous buy-in from the leadership at the park board as well as the city. And that buy-in was so important for the buy-in for our board leadership to approve the project.
Let's talk a little bit about health equity. What are your thoughts about health equity and how will the opportunities and issues in the communities that you serve? Carol?
Well, thank you. That's a great question. And it's so important because we in the foundation, we want to go places that are underserved. So we served older adults. That's a marginalized population. And then we try to serve older adults of color.
And also along with that, it was the diversity side. When we looked at this location and where we wanted to have it, we was able to see that there was a difference in income in some areas, as well as there was very diverse group of people. So with the support of city council and others, they wanted to make sure that we was able to meet the needs of all.
Carol, the amenities and the services at the center remind me of what we would find in any upscale facility. Am I right about that?
We like to call these one-stop centers. So we find that with a broad variety of programs and amenities, we can have something for everyone, which is so important. And we want anyone who walks in the door to feel like that they're getting the best there is to offer in the community. The movie theater, a movie theater license so people don't have to go someplace else and buy popcorn and Coke at $20 and they can see the latest releases. I mean, that's just one example of what we try to bring into the local neighborhood.
I want to talk a little bit, Daryl, about older adults in our community and the role they play.
Older adults, I think they carry a sense of character and respect that goes down to others. You know, our children, our youth, they're getting out more, they're driving longer, they're living longer, they're exercising, they're very vocal within the community, they volunteer, they're probably one of our highest voters in the city. So they get out and vote and they encourage that. We have what we call a senior advisory council where they meet with us, they give us suggestions, they give us ideas.
There's a myth out there that older adults are a drain. As this growing aging population, we hear about the baby boom and how many 74 million boomers, and that's somehow a drain on the resources of the country. And the centers that we have helping people have good health, promoting community engagement, all of that changes it. It gets rid of that myth and it demonstrates that there is a role for older adults in our community. It gives people purpose. And for me, it makes older adults visible in a positive light.
The numbers are outstanding. Over 3,000 older adults registered, 10,000 persons involved and engaged. How does that come about? What's the magic in these outstanding numbers of engagement.
Well, I think that we really work to reduce the barriers or remove the barriers of participation. There was a $10 annual membership fee and $5 monthly dues that had to be paid. And so the first thing the WellMed Charitable Foundation did is take over those fees so that the older persons could participate at no cost. It's conveniently located. All of that kind of dedication to removing barriers, I think, pays off.
And when we started out charging $10 for the annual year and $5 a month, it really didn't sound like a lot. But a lot of times I would get a call from a senior saying, oh, I can't come this month. I don't have $5. And, just to hear that really, really touched me. And so once they came along and provided assistance in paying for the $10 annual fee and the $5 monthly fee, our numbers went from like 1,200 individuals up to 6,000 in no time. Seniors start coming into the facility, and I didn't really know that cost had that big of an impact on people interested, unable to come in and participate in our facilities.
What are the lessons that we can take away and you can share with us about bringing this kind of vision to life? Carol?
You've got to have a common goal, the transparency in the communication when things aren't going well, being honest, and then building on the things that are going well. And then the buy-in of both the leadership of the respective organizations and bringing along the community.
One of the biggest lessons that I feel I learned was that if you take a great program, a great project with a good partnership, and be able to share with those that are able to make those decisions, that it can work and how it benefits the community and our seniors.
You just mentioned partnership again, and I want to talk a little bit about that. What it takes to have a good partnership. And you also mentioned the buy-in piece. Daryl, talk a little bit more about that, and then we'd like to hear Carol's perspective on it too.
Transparency. Very open and honest and being transparent. Lots of good communication. Just sharing great information about ourselves, about our city, about our leaders, about our seniors. These conversations took place day in, day out.
One of the reasons the partnership works is because we have highly defined areas of responsibility. So Daryl and the Park and Rec Department, they run the physical activity program. And so, if something happens related to physical activity programs, we're going to ask Daryl to go ahead and help lead that decision. And so I think highly defined responsibilities, a common mission, and bringing along your leadership with you so that when Daryl and I get excited and are ready for the next big idea, the leadership are ready for that.
As we come to a close, any final thought you would like to leave us with today? Carol?
My thought is to continue to move forward for health equity. We have just scratched the surface. We could really, really reach a large population that we're currently not reaching.
Daryl?
Yes, I have to agree with Carol on that. The health equity is a very important part of the city, our state, our country. And again, I'm hoping that this model, this partnership that we have, that others throughout the country, again, can continue to work towards these type programs for seniors, and as well as here in the city, that we can offer more.
Daryl and Carol, thank you. Thank you for sharing your thoughts with us. Thank you for your leadership, for your partnership, for your commitment to health equity, to your commitment to older adults. On behalf of the Robert Wood Johnson Foundation and the National Park and Recreation Association, congratulations on your award.
Thank you.
Thank you.
Thank you for joining us for this conversation, and you are invited to more conversations with the 2020 winners of the RWJF Award for Health Equity. And you can learn more about all of the winners at rwjf.org. I'm Jacinta Gauda, and thank you for watching.